Today on the show, we're focusing on cardiac arrest, and to help us with a conversation, we have Dr. Leonard Nze Ngunga, who is a consultant interventional cardiologist from Aga Khan University Hospital here in Nairobi. And we also have John Njuguna Kahiro, who's here to share his journey and his experience as far as cardiac arrest is concerned. So very quickly, I'm going to go to you, John. So at some point, you were feeling some of these symptoms. You would go to a hospital, like we were discussing earlier on, and they said you were given some medication to help you with the same. And that was it until you had a case of cardiac arrest. So would you remember when you woke up and you saw Daktari, or not Daktari, the people around you, what was the first thing that came to your mind?
In fact, I was so shocked because I had a nice sleep.
Okay.
That's the thing. So when I came, I wake up and find the people pumping me, lying on me. I was still asking, why are you killing me? It's only one person who said, no, Mzee, we are not killing you. We are assisting you.
Yeah.
But after waking, I had a lot of pain. That's what I can say. Though within the course of that week, I had no sleep. I was not sleeping at all.
Okay.
I could spend on 30 minutes, and the whole night I could spend without sleeping. Because when I sleep a little, I become breathless. So I use most of the times during the night. I was sleeping about 20, 30 minutes until the morning.
Okay. All right. So difficulty in sleeping, I'm pretty sure you... So when you were told that, listen, you had cardiac arrest, what was the first thing that came to your mind?
Well, I came up with a lot of people trying to explain to me how it was happening, because, it was almost 1 hour since I regained my understand consciousness. So they were telling me that how it happened and how it was going on. But initially I was shocked because I never thought that could happen to me. That's all.
Yeah. And before then, so what state would you say you were? Like, would you consider yourselves healthy? Would you consider maybe, you were sick at some point, or what exactly happened? I'll come back to you, Dr. to help us understand that, because I'm sure there's someone who's watching us and thinking, so who is at risk of cardiac arrest? Is it just anyone? Is it someone who has, a pre-existing condition? But what would you say before the diagnosis?
Well, after that, I was so happy because there's no time. I was sleeping as usual, like a small kid.
Yeah. And before that, your cardiac arrest?
I had a very terrible life, I may say. In fact, within the 1 week, I had a lot of problems sleeping. I could not even. But after the illness season, I've been attended. I could sleep nicely. I had no issues at all. And even there was some sort of, I feel a lot of gas inside my stomach. I couldn't even, sleeping was an issue. So after that, I could not feel it any longer.
Yeah. Okay. Doctor, let's go back to a diagnosis as far as cardiac arrest is concerned. So who is at risk? Does it just get anybody, or is it, who is at risk?
Worldwide, and Kenya included, the commonest cause of cardiac arrest is actually heart disease.
Okay.
More than 50% of people who get cardiac arrest, it is commonly related to heart attacks. So heart attack is by far the commonest cause of cardiac arrest. The second common one is what we call heart muscle disease. So it means apart from the heart attack means an artery has been blocked and the heart is suddenly unwell. On the other hand, you may have people who are what we call heart muscle disease. That means the heart is weak, it's not working very well, and the heart is straining. And that's the second largest group of people who are prone to cardiac arrest.
Okay.
So number one is people who have what we call ischemic or coronary disease, what we call ischemic cardiomyopathy, 50%. The next largest group is a group who have heart muscle disease. Another group now comes in, which are people who have heart rhythm problems, all right? Rarely, cardiac arrest is caused by other problems such as a large artery in the body, for example, tearing like the aorta. So people who have what I call aortic aneurysm, in the rupture, suddenly those people will bleed and their heart will no longer pump. Another one is blood clots. So you have heard of people developing blood clots which go and block the heart. Those are also notorious for causing cardiac arrest.
Okay. John, any of this sound familiar? Have you been diagnosed with any of what Dr. had mentioned?
They were coming to me like
Yeah.
some sort of feelings. Like when I say that the breath is unable to breathe and also sleeping nice. And that's what I knew in that part of it.
All right. So you say more of like heart attack.
So for John, for example, he came to the hospital because he could not breathe, as he's clearly saying. And once he got his cardiac arrest and we got his heart rhythm to normal, the next step was to take him to a cath lab where we went to determine whether indeed he has what we call coronary disease or acute heart attack causing the cardiac arrest. What did we find? We found that his heart arteries were actually normal. They were not blocked. However, his heart was very big. He has a heart muscle disease, what we call cardiomyopathy. So once we found he had cardiomyopathy, we put him on treatment, and he felt much better. He told he could not sleep. Now he could sleep. Before he went home, we put a special device called a defibrillator, which he has lived with for more than 5 years. And that device is called a Watchman device, because once the heart is weak, there's a high tendency, or you are prone to developing those abnormal heart rhythms. And John has that device which basically sits in there and watches his heart.
Is it a pacemaker, like, layman?
It's a special pacemaker, correct?
Oh, special.
Yes.
Okay.
That special pacemaker that John lives with is actually a very useful tool.
All right.
Over the last 5 years, has it given him problems? The answer is no. However, he has done very well with medication. So since he came in, we put him on drugs. John is back to work. He's able to do many things.
Absolutely. And that again gets me to my question that, I was to ask before we went on a break, and that is, in a case of cardiac arrest, an intervention should be made immediate. So how immediate is immediate?
So immediate is, so once blood supply stops, and by the time patients are falling down, it means already something has happened. It means basically you had like 1 or 2 minutes when there's no blood supply to the brain, because the brain is one which keeps the body intact. The heart is just a pump. So it means the patient collapses. You have to start CPR within 1 or 2 minutes.
All right. And John, again, like you said, so you're put on medication. Do you have a special pacemaker, the one that Dr. says on? How are you doing? How is, what is your journey like with medication? What are some of the changes that you've had to make just to make sure that you're okay? You're able to sleep well.
I'm able to sleep well.
Yeah.
I'm able to continue with my routine.
Yeah.
And I may say, I've never seen something which can amaze me now. Because in case of any issue, I just press the doctor, I call him for any advice.
Yeah.
Sometimes it rings inside me.
Yeah.
So I have to call what is ringing inside. Because
Okay. Yeah. And when does he say?
he just come. When I come, he told me, okay, it's because of this and because of this, and he knew that we come back now.
Yeah.
So it's like what I said, it's a watch. In fact, it's a watch.
It really is a watch.
It's a watch.
Okay.
That's what I'm saying.
So you're taking your medication. But then again, so what is the biggest challenge? You were talking about this earlier on, and you said sometimes the medication can be very
challenges can be on the medication. That's one. And I may say, apart from medication, that's nothing else. Because you have to live with the medicine.
Yeah.
You have to live with the medicine.
How many tablets? We're talking about 6 tablets you're taking in a day. You spend like 50,000 shillings a month. Yeah.
And I'm taking every night.
Yeah. I can only imagine how much of a burden that is. And I'm going to take this as your parting shot. So having gone through, this process, you are here today to share your journey with other people and tell people, listen, it is possible to still live a near normal life, just like any other person once you get the intervention. So what is it that you want to tell the people and the government, and especially after the cost of medication?
Well, first of all, I would like to thank Aga Khan University. Because, in fact, they did a lot of assistance to me during that time. And most of whatever, or even the medication, and even also the machine itself, I think we cost share together.
Okay.
That one I'm thankful. And also I say, all is not bad, because if you realize that you are in this trauma or you are in these problems, if you can attend the clinic to the right doctor, they can be able to assist you.
And Dr. There's so much to cover, but unfortunately we have to end the conversation. So when it comes to treatment, very quickly, in some cases, some might need a pacemaker, but is this always the end result, or are there other treatment options that are available, depending on maybe on the severity?
So we've made a lot of progress in treating patients like John here. And indeed, a pacemaker is really a great invention. So because if, for example, John got an abnormal heart rhythm when he's in his house or going about his duties, because sometimes patients want peace of mind. No one wants to walk around knowing, oh, I can collapse somewhere. That pacemaker kind of gives you that peace of mind that if something happens, he'll get treatment. Maybe, of course, if he gets a treatment, he'll be like, oh, what has happened? He has to come back to the hospital.
Is that the warning, the ringing?
Yes.
That you said that once you that something is not right.
And then we adjust our medications and we make sure he gets going. Okay. So if patients do well like John, it's a good thing because it means medication is sufficient. Occasionally, they don't do as well as this, so we have to upgrade the kind of, for example, pacemaker they have into more complex pacemakers. And indeed even more complex medications. So it is true that we do have patients who may not do so well with medication, but the majority of our patients do very well with medications.
So what is it that we can do to prevent, very quickly, because we need to end the conversation, and also you want to speak a little bit on the cost of treatment and what can be done to sort of like subsidize the same?
You mentioned two things. As I said, cardiac arrest is caused primarily by heart disease, and the commonest of them is what we call coronary artery disease, which is caused by cholesterol problem, which blocks the heart arteries, and then clots form, and then people develop heart attacks. Whereas the second commonest cause is what we call heart muscle disease, caused by other diseases. And again, the commonest cause of this is hypertension. Hypertension is a very common cause of weak hearts.
One of the things that I found is that if it's not attended to immediately, then it could lead to death. So my biggest question is, how immediate is immediate? Because it's like we're dealing with a very short window of time, but you'll answer that after the break, because we have to take a break right here on Health Diary. So much to discuss right here as far as cardiac arrest is concerned. So we'll see you on the other side of the break. Welcome back. So if you're just joining us, today our focus is mainly on CPR. I'm pretty sure you've heard about CPR, but do we really know how to perform CPR and what exactly it's all about? So help us with that part of the conversation today. We have Roseanne Nyabera, who is a cardiology manager right here at Aga Khan University Hospital. And we have our dummy here. Do we call him John?
Yes, I think we need to call him John.
Okay, call him John for the purpose of this demonstration. But before we even, get to see the practical part of the same, CPR, can we just get to understand what is it all about and what is the most important thing that people need to know?
Okay, thank you so much. So CPR stands for cardiopulmonary resuscitation. So that's the full, but it's a long word, so we just use CPR. And CPR is part of resuscitation, but today we're just going to focus on how we can recoil. You remember Dr. Gunga talking about making sure you press deep and fast so that the heart is able to expand and push the blood out.
He said perfuse the heart
and the brain.
Yes. Yeah.
So that's CPR.
That's basically what we're doing.
Yes.
And we were discussing this with you, and you said it's different. CPR for adults and for infants.
For infants and the slightly bigger children, yes. For the neonates and infants and younger children, it's different.
It's different.
So Mr. John is an adult. So today we're going to focus on
CPR in adults because we're relating to a conversation that we had as far as heart attack and right. And okay, so very quickly, just in case someone is tuning in right now and did not catch the first part of the conversation, so what instances would necessitate for a CPR?
Yes, so we are looking at a situation whereby somebody or a bypasser witnesses a client or someone who has either fallen down, and we need to see what to do instead of just looking at the person who has fallen down. So that's why we said that you need to check on some things that are basic and can be done by anybody. You don't have to be a medic. Okay. Yes.
All right. So what are some of these things that we need to check?
So if, let's say you're sitting in a restaurant, and you're having your food and the person next to you falls down. Okay. Immediately, you need to look at your surrounding and check whether you're safe, you yourself first, because you can't do CPR if you yourself are not safe. Yes, so check your surrounding and immediately go to the person who has fallen down and check for the pulse. Okay. Yeah, so the pulse is the heart heartbeat.
Yeah.
And there's a way you can check. When somebody arrests, you don't have to go on the hands. You will not get it because already you are told the blood flow is reduced.
Yeah.
So I'll show you where to go.
Okay.
It's just a touch.
Yeah.
But if you touch and you don't feel anything, try and call the person by name if you know. If not, you tap them a bit and see. If they are responding, they'll respond to you.
Okay.
But immediately you realize they are not responding, then you need to switch and think CPR.
Okay.
Yes.
All right. And think that very fast.
Yes, very fast. So your surrounding is good, and you've confirmed that they are unconscious, so you ask for help. You can scream, help,
Yeah.
someone will come, and immediately you start CPR.
Okay. And Dr. Gunga mentioned, so you call for help,
Yes.
number one, and then ask them to call for an ambulance.
When the call comes,
Yes.
because somebody will come,
Yeah.
then you need to clearly state to them why they've come and what you need.
Okay.
So you will call, tell them, call an ambulance. They don't know.
Yeah.
That's why we need to have the numbers on our phone. Then you remove your phone, give them, tell them where to go, and call the number.
Okay.
Otherwise, they won't know. If they call 999, maybe nobody will come. Yes.
That's true.
So it has to be clear what you're looking for.
Exactly you're looking for. Okay. And then in the meantime, you start CPR.
yes.
Okay. So shall we?
Yes. So now we'll go on our feet.
Okay.
So if someone gets an arrest when they are sitting, you need to look for help so that you go down. You cannot do CPR while you're sitting. Yes.
Okay.
So
All right, so we need to-
so we go down.
Okay.
Yes. I think you'll need to come here.
On this is the side.
Yes.
Okay. All right.
So always you have to be across, yeah?
Oh, so I
yes.
need to move further.
There,
Okay.
yes.
Okay. Okay.
So like I said, you look for pulse, so don't look here. So with your two fingers, you touch, you think this, yes, here.
Yeah.
Yes, just touch.
Okay.
You touch like this.
And this. Okay.
Yeah, with your fingers, these three.
Okay. Three
Yes.
fingers.
Yes,
Okay. And then you
like
touch.
this,
Okay.
yes. And then you will feel. If there's a pulse, you will feel it.
Yeah.
You want to try on yours?
Yes.
Just do this.
Just
Yeah.
Right.
Yes,
Here.
yeah. Can you feel something?
Yes.
Yes,
Yeah.
that's all you look for.
Yeah. If you don't
Provided
feel
it's
nothing,
there,
yeah.
then you can't do CPR.
You know, sometimes it can be faint.
Yes,
Like
but it's
very
there.
faint, but it's there.
Yes, because
Okay.
CPR you only do because the heart has stopped.
Yes.
When there is a pulse, the heart is still beating. Then now you need to look for help because the person is still. So if there's pulse, I'll ask, hello, hello, are you able to hear me? Then you'll see there'll be some movement because the pulse was there. Yes. But if there's no pulse, even if you try, there's nothing. So you don't go there.
Okay.
Immediately, you can open or you have an assumption. These are the nipples.
Yes.
This is Mr. John, so is, yeah. So you look at where the nipple is, the center.
Okay.
Yes.
Right over.
Right there.
Okay.
Yes.
You know, it's very easy for us to go here.
Yes,
'Cause
where
we're
the
told
heart
where
is.
the heart is.
No,
So that
you don't. Yes, right in the center.
Okay.
And then you have to remember, are you a lefty or a righty?
Okay,
Yeah. So like
yeah.
me, I'm a right. So my
hand
dominant
as
will
well.
be this. That's what
The
goes
right.
first.
Okay. All
Because
right.
this is stronger. Yes. And then you
Okay.
use your palm. You place it there.
Okay.
You've seen?
Yeah.
Yes.
I want you to
I'll do it.
Do it so that I
Yes.
see.
Yeah.
Because
So
otherwise,
this-
yes.
The sternum here.
Okay.
Then you place, and then you are dominant. You put like this.
Uh-huh.
You see the way my hand is?
Yeah.
Because I'm going to press using, yes. And then once you press it, then you come over the patient.
Okay.
Over. You see, I'm not like this.
Yeah.
I'm straight because we
Yeah.
want to do 90 degrees.
Yes. So your shoulder.
Yes, has to be straight.
I see that. I see that.
Yes, so you hold like that, and then you have to press fast and deep.
Okay. Okay. Okay.
So when you reach 30,
Yeah.
you're able to look again. if
Again,
there's a
and
pulse.
yeah.
So by that time, there's help.
Yes.
So when the help comes, you'll ask them, do you know how to do BLS? Are you able to do CPR?
Yeah.
Because it's tiring.
It is. I can,
Yes.
I mean,
It's not easy. So
Yeah.
they come and help you.
Yeah.
And if they are not able, just tell them, call this number.
Okay.
And you continue, unfortunately.
Yeah.
Until somebody else comes to help you.
Okay.
So you should not stop.
So do you do that? Because I've counted. You've done 30.
But yes.
So and then check.
Check.
And then
Continue,
So
yes.
that is the
Yes,
standard.
yeah.
Like 30.
Because once I do
Yeah.
the 30,
Yeah.
blood is flowing. So if I've managed to press, you know, when you're pressing,
Yeah.
the heart goes like flat and
Yes.
Yes, so at least there's circulation.
Yeah.
And that can revive the patient.
Okay.
Yes.
So what is it that we do wrong when we talk about
the,
CPR?
Yeah, it's the placement. People
Okay.
think the heart is here, so they come there.
Yeah.
And then you're doing CPR, you've seen on TV, so you're just doing like this.
Yeah.
That cannot work.
Yeah.
Cannot. There's nothing you're doing.
You're not
Yes,
helping this person
yes.
because the heart has stopped.
Yes,
And you have to
press it.
Yeah.
Fast and hard.
Okay. All right. Fast and hard. 30.
Deep,
Check
yes.
for the pulse.
Yes.
Could do that until
Until rescue comes.
Yeah.
So immediately rescue comes, most probably they'll come with a crash cart
Yeah.
or a bag, then they'll do advanced now.
Okay.
Now they can do the other things.
All right.
But for you just continue.
You know what usually used to happen before? So you do the compressions and then mouth to mouth.
Yes.
Does that still happen now?
No. So
Okay.
it used to be ABC, airway, blood and then circulation.
Yeah.
But the latest is you go straight to CPR.
Okay.
Because that's what will save life.
Okay.
Initially, we used to listen, you know.
Yes, and then try
Yeah.
call,
No,
nothing
no.
happens, and then you
Go
go
pulse
in. Yeah.
quickly. Yes.
Yeah.
And you see, if the person had fallen down,
Yeah.
you didn't feel the pulse,
Yeah.
but they are not unconscious. Immediately I do what I'm doing, they'll wake up.
Ah, okay.
Yes, because it's fast painful. You know, I'm going deep.
Yeah.
Yes, I'm
I
doing like
see
this.
that
Yeah.
and I'm like,
Yeah.
okay.
They'll wake up. It's not comfortable.
Okay.
Yes.
Can I try?
Try.
Okay. So I need to come
You
on
remember
the other
the
side
landmarks? Yeah.
Yes.
You come
Okay.
this side, but you can do from either side.
Oh, really?
Just go round.
Okay.
Yes.
All right. So, so what you said? First of all, you need to
Listen to the pulse.
Right. So 3 fingers.
Yes, the other way around.
Yeah. Oh, okay.
Like this. Yes.
Oh, okay.
Yes,
See,
like this. You see?
I'm already doing it wrong.
Yes,
Okay.
yes.
So listen. If there's no,
If there's nothing,
immediately.
yes, ask for help.
Yeah.
Yes.
Okay. So the
Yes,
nipples,
yeah.
right? Like this is
That's
the
good.
marker. So
There.
there at the center.
Yes.
All right.
You're-
Dominant, some right-handed.
Yes.
So
So
what
put
do I
your
do?
left down.
Okay.
The one that's right will help because
Okay.
it's stronger.
Yeah.
Yes.
And
Have
then-
you put in the middle? Yes.
Yes.
Yeah.
And then.
Come towards the patient. No.
Okay. Oh yeah.
You
Just
have to be at 90.
Okay. Like
Yes,
that.
yeah.
All right. And then.
Yes. Kabisa.
Hard work. I'm not gonna lie. But yeah.
Yes. And
You
then
have to put in a lot
yes.
of.
Yeah. You have to press. You're getting-
Okay.
yes. You have to. And don't remove your hand from down. Eh?
Yeah. What? Okay. Let me try one more time. Okay.
Go. Yes. Yeah. You see. Yeah.
Whew,
At least
30
that will
times.
be. Yes. Yeah.
Wow.
If
Okay.
you're strong enough, like the men, they can go 1 hour before they even
Ah,
listen. Yeah.
Okay.
Yeah,
All right.
yes.
But standard. So count 30.
Yes.
We can say.
Yes.
Listen. If again you don't feel nothing,
You
continue until.
Yes, somebody
help
comes. So if a second person comes now, we are 2 of us.
Yes.
I'll do 1 hour and then we exchange. We keep on one
Yeah,
cycle.
Yeah.
Then we keep on exchanging.
Yeah.
So there's even a way before I change.
Yes.
I have to inform you so
Please
that
help.
there's
Yes.
Yeah,
Because me, I
so
was just
that-
like, okay, 30 go.
yeah, because we shouldn't.
Yeah.
We have to be synchronized.
Yeah.
So that the heart is continuously
All right.
pressed.
How do you do it?
Yeah, yeah. So
Okay.
that's what happens.
All right. So how does the synchronizing part come in? So what do
Synchronizing,
we do?
yeah.
Yes.
So when I'm doing compression,
Uh-huh.
I'll tell you change at 1, 2, 3, 4, 5. So immediately
Okay.
you come.
Ah, okay. All right.
Yes,
So
yeah.
go.
Changing at 1, 2, 3, 4, 5. Yeah, and then you like that. So you synchronize.
Okay. All right. Okay. Because we don't want Bottom
Yeah.
line is we do not, we
Yes,
want
the
to,
heart has to continue. We are helping
Yeah.
the heart to pump. That's all we
Okay.
are doing because
All
the pump
right.
is unable.
You know what?
Yes.
This has been very
Yeah.
informative, very few minutes, but now we know better. If
Yes.
anything, I could say for myself, we
Yes.
know better.
You can save
Yeah,
somebody.
thank you.
Thank you.
What?
Yeah.
Okay, how about we take a look at this health tip as we say special thanks to Roseanne Nyabera, who is a cardiology manager, for helping us understand how to perform CPR. So take a look at this health tip.
I'm going to show you how to tone your biceps. Bicep, this muscle here. What we are going to do is called the barbell curl. Hold it this way, bend your knees slightly, put your chest out, and then you take it slowly from down, up towards your chest, then back down, up, and make sure it's only the arms that moves. You go for many repetitions. That will help you burn the fats. The lighter weight is the one you can use for many repetitions. We also have biceps with the dumbbells. Dumbbells are these ones. This is the move. Take it this way. It's like you're doing forearm, then you turn. That one will go for the biceps. All right? Same to this side. So you can alternate it. You can alternate it. And remember the counts. Many repetitions will help you burn and tone more.
Well, that marks the end of our conversation today as far as understanding cardiac arrest is. And now I know you know the difference between cardiac arrest and a heart attack. But if you still have more questions, our social media handles are down at the bottom of your screen. Use them and let's keep the conversation going. My name is Winnie Lubembe. A special thanks to the Aga Khan University Hospital for hosting us today. Until next time, adios. Did you know that your heart is the size of your feet? Fists. Feet. My name is Winnie Lubembe on behalf of